Let's think about your eye for a second. Right at the very front, you've got the cornea.
In fact, corneal diseases are one of the leading causes of blindness around the globe. So today, we're going to take a closer look at what that really means.
The very first signs that your window to the world might be starting to cloud over. Okay, let's translate this list into what it actually feels like day to day. Diminished vision. Well, that might just seem like, oh, I probably need new glasses. That glare could be what makes driving at night suddenly so difficult. And that irregular feeling, it could just feel like there's an eyelash in your eye that you just can't get out. These are the classic signs that something's up with the surface of your cornea.
And the official term for this is corneal opacity. It's really exactly what it sounds like. The cornea, which is supposed to be totally transparent, becomes opaque or cloudy. And the really crucial thing to understand here is that this isn't just some temporary blurriness. It's caused by actual, physical scarring on that delicate window of the eye.
But here's the thing, not all cloudiness is created equal. This table does a great job of breaking down the different levels of severity. So a nebula, that's like a faint little smudge on the window. It's annoying for sure, but you can mostly still see through it. A macula is more serious. It blurs your vision in a much more noticeable way. But a leucoma, that's a dense white scar. That's like having the curtains completely drawn, and it can cause severe vision loss.
And, if this is left unmanaged, the consequences can be pretty serious. We're not just talking about blurry vision here. The scarring can physically change the shape of the cornea itself, which can cause astigmatism. And in some rare cases, it can even mess with the eye's internal pressure system, leading to glaucoma. This is exactly why catching it early is so incredibly important.
So the causes are actually surprisingly diverse.
A whole host of things can scar the cornea. It could be an infection, maybe from not cleaning your contact lenses properly. It could be a physical injury, like a scratch or a chemical burn. But it can also come from something happening inside your body, like a vitamin A deficiency, or it could even be a condition that someone is just born with.
So how does a doctor figure all this out and confirm it? The process is really logical. It usually starts with a simple torchlight for a general look. Then comes the slit lamp, which is basically a super powerful microscope for your eye, and that allows for a really detailed inspection. Of course, they'll test your vision with the classic eye chart, and they might use a special dye called fluorescein. It glows under a blue light and perfectly highlights any scratches or tiny defects on the cornea's surface. There are clear, established paths to treatment that are designed to manage the symptoms and, in a lot of cases, restore that lost clarity.
Broadly speaking, treatment breaks down into two main camps. On one side, you've got medical management. You can think of this as controlling the situation, so treating any active infections, managing symptoms, and just keeping the eye comfortable. Then, on the other side, you have surgical management, which is all about a direct fix, actually repairing or even replacing the damaged tissue itself.
Let's look a little closer at those medical options. If an ongoing infection is causing the problem, step one is to fight it with antibiotics or antivirals. For all the discomfort and irritation that comes with it, lubricating eye drops can be a huge relief. And then anti-inflammatory drugs can help bring down any swelling. This is all about managing the problem that's happening right now. But what about the scar itself? Well, that often requires surgery. For milder scars that are just on the surface, a laser procedure called PTK can be used to precisely remove that damaged layer of tissue. But for the deeper, more severe kind of opacity, like that glaucoma we talked about, the gold standard is a keratoplasty. You probably know it as a corneal transplant. It's the ultimate fix where that scarred, cloudy window is replaced with a clear, healthy donor cornea. Of course, the best treatment is always prevention, right? So for our final section, let's talk about what you can actually do to protect your corneas and keep that window to the world as clear as possible for as long as possible. And the advice here is super direct and actionable. If you even think you might have an eye infection, see a doctor right away. Don't wait. If you're doing yard work, playing sports, anything like that, wear eye protection. It's so simple, but it prevents so much trauma. Make sure your diet has plenty of vitamin A. Think carrots, sweet potatoes, leafy greens. And if you wear contact lenses, you have to be absolutely meticulous about hygiene. These steps are your absolute best defense. So at the end of the day, the way we see the world literally shapes our experience of it. The clarity of that vision is just so profoundly important. So I'll leave you with this question to think about. How are you actively protecting your window to the world? Thanks for joining us.